What is dependent lymphedema? Dependent edema, also known as peripheral edema, is a type of swelling that occurs when there's a lack of muscle pump activity. Dependent lymphedema is a type of secondary lymphedema arising from dependent edema and subsequent damage to the lymphatic system. Dependent edema is caused by the accumulation of fluid in the tissues, usually as a result of gravity and prolonged standing or sitting. If you think about the last time you went on a long flight and sat for over 10 hours, it's likely that your legs were a little swollen. One reason that swelling occurs on a long flight is because the muscles of the legs are not able to effectively pump fluid out of the legs. Dependent edema can also be a symptom of an underlying medical condition, such as heart or kidney disease. It is important to seek medical attention if any symptoms of swelling appear. Pictured on screen is a severe form of dependent edema. This is from a published case study of a 76-year-old gentleman with mental illness. He had not left his home in over 3 years. He had an ultrasound Doppler performed which did not show any venous incompetence, meaning that he did not have a problem with his veins that could explain his swelling. Instead, he was overweight and sat for many hours each day. He slept in a chair, with his legs resting downwards, for nearly all of the day, causing dependent edema, and over time a secondary lymphedema. The severe skin changes on his legs are part of the changes to the skin that occur in a chronic case of lymphedema. The skin changes can significantly improve with suitable lymphedema treatment as part of the Kessler-Smith method of complex physical therapy. Most commonly, dependent lymphedema is seen in patients who have obesity, with limited ability to walk, or patients who are in wheelchairs, post-strokes, or other neurological conditions, whereby they cannot get up and walk around like normal. Lower limb swelling can start slowly and then can become a lymphedema if the lymphatic system becomes overwhelmed and damaged. Research has shown that as swelling progresses, the lymphatic vessels themselves become damaged. This is why any symptoms of swelling should not be ignored. To learn more, visit www.instituteoflymphedema.com.au.